Before entering the patient's room, I would check to make sure that there was a physician's order to perform the ABG. I would then check the patient's chart and look for any significant findings, including diagnosis, any allergies, if they are on anticoagulant therapy, and the patient's most recent temperature. I would then set up my equipment here, or gather it. I have 2 ABG kits. I have a towel to go underneath the patient's arm and a sharps container. I would then wash my hands and put on gloves. And then I would introduce myself to the patient. Hello, my name is Wayne. I'm from the respiratory department. I'm here today to draw some blood from you. Can you please tell me your first and last name and your date of birth? I would verify that information by checking the patient's wristband. At this point, I would then palpate the radial artery and then perform the modified Allen's test. And I would palpate the ulnar artery as well, and then occlude both arteries. I would have the patient squeeze his hand about 3 times, and I would look for signs of blanching in the hand. Once I see blanching, I would release the ulnar artery and look for blood flow to fill back into the hand, which would be collateral circulation in case the radial artery is punctured or injured during the ABG. I would then set up my equipment. I have an alcohol swab to clean the puncture site. I have a Band-Aid. The patient label, which I will fill out at the end of the procedure. I have a transport bag and the gauze, as well as my needle and syringe. Set up my needle. I would take the stopper out, leave that close by. Okay. And I would make sure that the needle is set to 1 cc, which is the amount of blood that you need to properly analyze a blood gas. I would then, I would clean the site, the puncture site, for about 30 seconds, and then I would let air dry, and I would also clean my 2 fingers that I will use to palpate. All right, I would then repalpate and check for the pulse, and then prepare my needle. I want to make sure that my hand is in the palm of the patient's hand. And I want to make sure that my bevel is up, and I go in at a 45-degree angle. I'll go through the skin quickly, and then once I go through the skin, I'll slow up so that I can check for a flash of blood from the artery. bevel is up, I'll take off my pointer finger. Okay. I did not get any blood that time, so I will redirect. I'll take the needle back out, not all the way, and then I will use my middle finger to follow the direction of the artery. I will then have to, for a redirect, move my entire arm and go back down. Okay, I get 2 redirects. I didn't get that one again, so I'll do it one more time. Okay, and one more time. All right. I will act as if I got blood that time. I will cap my needle and apply pressure to the puncture site for 3 to 5 minutes. And if the patient is on anticoagulant therapy, I will do it for 10 minutes. I then have my Band-Aid, which I will apply to the patient, which will continue to apply pressure. Okay. My needle is capped. I will uncap it. And put it in the sharps container. I'll then release any extra air. And put the stopper in. I will then roll the needle to mix the blood with the heparin. I will fill out my label at this point, which includes the patient's name, the room number, the time, the FiO2 settings, or the ventilator settings, depending on if the patient is on a ventilator or on room air, nasal cannula, or anything like that. The patient's temperature, the doctor who ordered it, the date, the puncture site, and the modified Allen's test result. This will go directly on to the syringe and into the transport bag. And this is what I will bring down to the blood gas analyzing lab. If it's going to take longer than 30 minutes, I will put it on ice. If it takes longer than an hour, then the sample is no good and will have to be thrown out. I will then clean up my area. This time I will make sure that the patient is comfortable. I'll throw out all of the garbage here. Take off my gloves. Wash my hands and leave the room. And then I will open up the patient's chart and document the procedure on the computer.